That we want everyone to be able to help save lives. So thank you again for being here today. It is now my honor to introduce to you our District Attorney, Eric Nazarenko.
Thank you very much, Dr. Johnson. To fentanyl dealers, traffickers, and smugglers, think again. If you sell this deadly poison in Ventura County, we will prosecute you and we will hold you accountable. Just in the last 2 years, our prosecutors have achieved multiple felony convictions, resulting in over 48 years of confinement in state prison and jail. And I want to thank and recognize Sheriff James Fryhoff and the men and women of law enforcement and those in the District Attorney's Office for helping to make this possible. For those drug dealers, sellers, and smugglers, if you continue to sell, think again. Because if someone were to die, you can and will be charged with murder. Recently, we filed a second-degree murder charge in a case involving an Oxnard defendant who sold to a 19-year-old who was found purple in the face, foaming at the mouth, and unresponsive in a Speedway gas station bathroom. And to recreational drug users thinking about or even contemplating snorting a line or taking a pill this Halloween, we say to each and every one of you, think again. That one line, that one pill will indeed kill. You have to presume that each and every illicit drug is cut, laced, or adulterated with fentanyl, and that fentanyl will kill you. We cannot prosecute our way out of this shadow pandemic. We must find ways as a county in a multidisciplinary, multi-agency fashion to prevent drug use from spiraling into harrowing addiction. That is why our office has teamed up with many of the partners you see assembled here today, specifically the Behavioral Health Department and the Ventura County Healthcare Agency. For example, low-level misdemeanor offenders in Ventura County Superior Court can now be diverted to a behavioral health substance use treatment screening facility, wherein they will be assessed for potential service and treatment options by drug addiction experts. To date, 140 of those low-level misdemeanants have been diverted into that screening, 98 of whom have been recommended for outpatient drug treatment services. And I also want to acknowledge our partner, Dr. Tipu Khan and the Ventura County Medical Center. As many of you know, he and the Ventura County Medical Center have established a nationally renowned withdrawal management facility, also known as a detox center. Our office in the District Attorney has taken seized assets from drug dealers and redirected those assets to combat drug crimes through the donation of monies that help to fund sober living scholarships at this withdrawal and detox center facility. To date, 215 days of sober living facility housing has been achieved thanks to these proceeds. It is now my honor and privilege to introduce the supervisor from District 2 here in Ventura County, Supervisor Jeff Gorell.
Good morning, everyone, and thank you for being here. I have the honor of representing the 2nd District here in Ventura County. It's on the east side of the county, is often thought of as a very nice place to live, residential community. A lot of middle class and upper middle class families live there. It's a high quality of life, great schools, and considered a very safe neighborhood. Nevertheless, to prove and to show that fentanyl knows no geographic nor demographic boundaries, 48% of overdose in Thousand Oaks, the largest city I represent, involve fentanyl. Fentanyl is a killer everywhere in this county and in this country. That's why it's so important for us to act in the way that we are, multi-jurisdictional. I do want to commend our district attorney and our sheriff for leading COAST. COAST is an opiate task force that got started early, got started before this became the crisis that it is in Ventura County, to get ahead of it with education and outreach and vectoring people into behavioral health and to prosecuting and bringing to justice these dealers who try to bring fentanyl to our community. I also want to commend family members like Lori Englander, who you'll hear from in just a moment, the true hero up here, the most important person you'll hear speak today, because it is her lived experience of having a family member die from fentanyl that is going to help us convince other families to get involved, to intervene, to speak up, to engage their family members. From 1999 to 2006, I was a prosecutor in this building behind me. I worked in major narcotics. We put a lot of time, effort, resources toward taking down drug dealers. And we did so because illicit drugs are chronically habitual. They will cause addiction. The addiction can ruin your life and can, under those circumstances then, could kill you. Today, the script has flipped. We no longer have waypoints along the way of addiction and loss and interference with your life and your family and contacts with law enforcement to know that you have a problem that needs to be fixed. Fentanyl can and will possibly kill you on the very first time you try an illicit drug in your life, whether you're 16 or 32 or 60. It's a killer. And it's a war against fentanyl, and right now fentanyl is winning. But with this education and outreach, the task force and the campaign being kicked off today, we are working to bring those deaths down to what we want to see, which is zero. This campaign provides life-saving information. The Think Again campaign brings together everyone in education, law enforcement, behavioral health in all of our communities, and the survivors and the family members of victims to get the word out that this is one of the most dangerous things that our community is or will face. And together, we can help fight fentanyl, and together, we can win. I'm now honored to introduce our sheriff here in Ventura County, Jim Fryoff.
Thank you, Supervisor Gorell. I am honored to be the sheriff of Ventura County, and we are facing a critical challenge with fentanyl. This Think Again campaign is much needed, and I'm thankful for our county to seeing that we need to make sure everybody is on the same playing field. Everybody has the information. Everybody out there, whether you think you're impacted or not, needs to share this information on your social media platforms, with your family, your friends, because that's who's going to be impacted. Much like Supervisor Gorell said, fentanyl overdoses and deaths do not discriminate by geographic location, age, socioeconomic status, ethnicity, or gender. In January of 2023, we, your law enforcement officials here in Ventura County, developed our focus teams. That's our fentanyl overdose crimes unit, specifically targeting fentanyl. This unit has investigated over 65 fatal overdoses, 99 non-fatal overdoses. We work hand in hand with our district attorney's office, who provides an investigator to prosecute these crimes. As with any drug with these type of profits, it creates a breeding ground for gangs, violence, and firearms. Make no mistake, the primary driver of these drug issues starts with the Mexican cartels. In addition to these cartels, there are other gangs taking part in the distribution and sales of these deadly poisons. We've seen this in numerous cases that Focus has put together, and recently partnered with the U.S. Attorney's Office and several other Southland agencies targeting a gang out of the LA area known as the Peckerwoods who were dealing in fentanyl. Our units recovered over $2 million in cash, recovered 48 firearms, seized almost 30 pounds of fentanyl, 32 pounds of methamphetamine, 23 pounds of heroin, 8 pounds of cocaine, and 66,000 counterfeit and pharmaceutical pills. It is imperative to have outstanding working relationships with our local, state, and federal agencies, which we do. We work to combat fentanyl in our custody facilities as well. As I oversee our jails, we have amnesty boxes when people are arrested to make sure they have an opportunity to surrender narcotic before it gets into our facility and impacts others who are recovering from drug addiction. We also have naloxone distributed throughout the jail and including in the inmate housing sections. We play videos to show the inmates how to use this naloxone as a reversal to save other inmates in the custody facility while our officers are responding. Finally, I'd like to everyone know the Sheriff's Office, in conjunction with the DEA, is conducting a drug take-back day where people can turn any unneeded or expired medication this Saturday, October 26th, between 10 a.m. and 2 p.m. in the cities of Thousand Oaks and in Camarillo. Please visit our website at venturasheriff.org for further details. I'd like to now introduce my good friend, Lori Englander.
Hi. First of all, this is my son, Jared. Jared died on September 16th, 2022 of an accidental fentanyl overdose at his place of work. My goal in being up here and sharing this with you is to show you that there is no them. We are all them. It doesn't happen to them. We are them. Fentanyl is in everything now. The dealers are putting it in counterfeit Percocet. They're sprinkling it through marijuana. It is literally accessible everywhere. It is easier to buy fentanyl for young kids than it is for them to buy a pack of cigarettes or alcohol. You can order it through Snapchat. You can order it through WhatsApp. Social media is a driving force in this. My son ordered it through Snapchat. It was delivered as easy as a DoorDash order. My son was a wonderful human being who made a choice at a very young age that he had no idea where it would take him and how it would affect his entire life. Nobody thinks it's going to be their child. I certainly didn't. We are the quintessential suburban family. Married 37 years, 3 kids, 2 dogs, and a house. My husband is retired law enforcement. We knew what to look for. And when I saw the signs, I started investigating further. But I couldn't catch it in time. And by the time fentanyl came into the picture, my son had lost so much, 10 years of his life, in pursuit of drugs, in pursuit of something to make him feel like he fit in. I am every mother. I am every community member. And my goal here is to make sure that there is no other parent left to stand up here, missing their child with everything in them, due to something that can be prevented if you have real conversations with your kids. As they've said before, there is no recreational use anymore. There is no experimentation that is safe. It is being put in everything. The first time a 13-year-old smokes pot to fit in with a certain group of friends can be the last thing they ever do. And it's my goal to make sure that doesn't happen to anyone else. This pain is real. It's devastating, and it's rippling throughout our county. The parents don't feel supported because the stigma around drug addiction is always about that happens to them. We are them. We are them now. So please talk to your kids. Never think it's too early. Thank you.
Our goal is to prevent this from ever happening to anyone again. And it's through the brave willingness of people like Lori, who has come here to share her story about her family, that we're able to understand the challenge and to define our goals. I'm Teresa Cho. I'm the director of the healthcare agency, and our focus at the healthcare agency is on two things: prevention and treatment. So as a healthcare provider, I'm going to start with a few facts about fentanyl, some of which you've already heard. Fentanyl is a very sneaky drug. It's not something we can detect with our own senses. So many illicit drugs can be laced with fentanyl and you wouldn't even know it. So it makes the substance cheaper, more powerful, and more addictive. As little as 2 milligrams of fentanyl, which is like 10 grains of salt, can be lethal. Fentanyl is a very potent opioid. It's 100 times more potent than morphine and 50 times more potent than heroin. And the grim fact that Dr. Johnson shared with us is that 7 of 10 overdose deaths in this county are due to fentanyl. And it's very important to realize that the vast majority of these deaths are accidental overdoses. So how do we prevent these accidental overdoses? There are really 3 pillars to prevention. So I want you to remember these 3 things. The first thing is use fentanyl test strips. So fentanyl test strips can tell you whether there's fentanyl in a drug before you consume it. And we now have these test strips locally in 16 of our motels, multiple bars, and our behavioral health team has gone out to make sure that we share these with community-based organizations so that they're available to the community. The second piece is to use Narcan or naloxone, which you've heard about previously. So Narcan immediately reverses the effect of fentanyl. It's a nasal spray, it's easy to use, you can carry it with you just in case. And to note, last year, of the Ventura County cases of fentanyl overdoses, of those who survived, 88% got Narcan. So it's very effective. Since 2020, we have distributed over 10,000 of these rescue kits that include Narcan, and that has resulted in almost 3,000 reversals. Our public health department is working with other county agencies like the libraries in our county to make sure that these rescue kits are widely available. And then lastly, I want to point out that we don't just wait for people to come to us. Our backpack medicine team that goes out into the field on a regular basis carries Narcan with them, not only for use, but also to distribute to those in the community who might need to use it at a later time. And the last pillar of prevention is to call 911. If you are at the scene of an overdose, please do not hesitate to get help for that person who is in trouble. California has a Good Samaritan law that offers limited protections from charges or arrests for people seeking help. So my plea is that please don't hesitate, call 911 because that can get the help that can save a life. I now want to turn to treatment because as a healthcare agency, that's our other real responsibility. Our treatment relies on our addiction medicine program, which you heard mentioned, Dr. Khan and his team, for the treatment of opioid addiction. We have fellowship training for doctors who want to become experts in this field. We offer clinical services in our clinics, both in Ventura and now expanded out to Oxnard. And we have a hospital detox facility to provide medical support for complex cases when withdrawal is an issue. We're working to get more primary care providers to prescribe medications that help with opioid addiction. And my plea is for those of you providers in the county to take it upon yourself to learn how to prescribe those medications because it really can save lives. And then lastly, and most importantly, I want to go to something Lori mentioned, which is to address the stigma of fentanyl use. Fentanyl, as you heard, does not discriminate. It affects people from all walks of life. Addiction is a health issue. It's not a moral failure. And it's our responsibility as healthcare providers to support an environment where people feel safe. Safe to come and get test strips, safe to come and get Narcan, safe to call 911. And it's our job to treat those with addiction with compassion and understanding. That's how we save lives. So I want to thank you all for being here today, for your commitment to addressing the fentanyl epidemic, which continues to have devastating effects in our community, as you've heard. This work is a partnership across all of the county departments that you see here today, and we hope that you join us in spreading awareness and information in this crucial fight. Again, all information you need to get educated, be aware, and save lives is available at thinkagainvc.com. Thank you.
So at this time, if there are questions from the media members, we will take those for our speakers who are up here today. The question is, how many cases are in the county so far? How many cases of fentanyl? Overdose deaths. I believe that's our medical examiner, Dr. Young, will take that question.
So the statistics for overdose deaths usually lag by several months because we have to get toxicology results and interpret those. Last year we were approaching 300 overdose deaths, the majority of which were fentanyl related. And the good news is I have looked at this year's data over the first 6 months and comparing that to the previous year, last year, we've seen somewhere in the neighborhood of 40 to 45 fewer overdoses this year. So that's really great news from a public health and prevention standpoint, and shows that, and this is similar to trends that are national that are showing some reduction. So this is something to get very excited about in these efforts to prevent these deaths. Yeah. And I think somebody else might want to handle that question.
Good afternoon, or good morning. My name is Dr. Loretta Dennering. I am the Behavioral Health Director for the County of Ventura. To answer your question, yes, we have a partnership with the Ventura County Office of Education and the districts throughout the county for naloxone distribution. Their schools have a naloxone in schools policy that allows nurses to provide training to administrators and staff, and partner with county and our community-based organizations on training and use in schools as appropriate. That's a complicated question because of the regulations on who can handle medications, but they are present in the schools, and the administrators and nursing staff have been trained.
The question is, what role would Prop 36 play in persecuting fentanyl deaths? That question will be for the district attorney.
Should the voters pass Proposition 36, it would codify or make permanent in the penal code what's known as the Watson-like warning. That is, if you sell fentanyl, and if as a result of that sale someone should die, you can and will be charged with murder. So it would make that a permanent part of the penal code. Similarly, if somebody has a loaded and operable firearm and they're also in possession of methamphetamine, if Prop 36 should pass, there will be an additional punishment or enhancement for that crime. It also requires drug treatment mandated felonies. So it would be a restoration in our county of what we used to call drug court, which essentially incentivizes treatment in lieu of a felony conviction.
We have time for one more question, and that will be it. And then our speakers here today will be available for interviews following the conclusion of the press conference. I think we're going to wrap it up at the moment. So thank you for joining us. For those of you who are members of the media, please stay behind and we'll allow the speakers to have interview opportunities with you. Thank you for joining us today.